My decision to become a physician really didn't become concrete for me until later in high school. I'd always loved sciences, found myself gravitating to studying those more so. I also love to help people. Even as a child, playing sports, I found myself gravitating to the injured players to wonder what was wrong with them, how we could help them, and it all just kind of came together, and I'm very fortunate that I get to spend the rest of my life pursuing this as a career. So I'm an ear, nose, and throat physician, also known as otolaryngology, and that's a specialty that involves treatment of the ears, nose, and throat. And the throat can involve from the front of the lips all the way back in the back of the throat, the swallowing mechanism, the voice box, which can include the vocal cords. So when you see me, we're trying to find what your complaint is and see how best we can treat that. My patient care philosophy has always been to involve the patient in their treatment plan as much as possible. I really try to give them education into what I'm thinking, what I'm seeing clinically, some diagnostic tools that we may use, and let them be a part of the treatment plan. And I feel that that gives them the best treatment outcomes. One word that describes me would have to be motivated. I feel like I'm a very motivated person, both professionally as well as outside of work. I'm always motivated to get to know my patients, to deliver the right diagnosis and care for them. But also outside of work, I'm very motivated to learn new hobbies, new skill sets. I'm a big do-it-yourselfer, and I feel like motivation's been a big part of that. If I wasn't a doctor, I can think of a few things I would enjoy being, but if I had to pick one, I would have to say a pilot. I've always loved the physics of flying. I love the precision and skill set that pilots have, and the two of those together I think would be a lot of fun. When I'm not at work, I really enjoy spending time with my family. My 3 kids and my wife, we love watching movies, especially comedy movies. We're always trying to get each other to laugh at various quotes and to guess what movie that's from. We also have a bird dog, and we love to go out and pheasant hunt and spend time with him in the outdoors. After an interaction with me, I really hope patients gain better insight and education into their complaint and their diagnosis. I've always felt it's very important for a patient to have education as to what I'm thinking, the different diagnostic tools that I want to use, and treatment outcomes that they may be able to obtain. And I always feel that better insight for the patient and education is a very important part of that.